Glecaprevir, Pibrentasvir, as you pointed out, already has a treatment indication that was back in August of 2017. The unique aspect of it is it's approved at 8 weeks duration for a large population. So anybody who is treatment naive and non-cirrhotic, regardless of what their genotype is, gets 8 weeks of therapy is what's recommended. So that's the broadest indication for an 8-week regimen that we have. And because it's available for 8 weeks for a large proportion of the population and was priced relatively aggressively, let's face it, the price sometimes matters in what the options are for practitioners, it's becoming more increasingly used. And so what this study I think provides is maybe some level of comfort for the very small percentage of patients that may fail, that we at least have some data on how to approach their retreatment. Again, overall, in kind of the registrational studies, 98% of patients were cured. There was, about a 2% failure rate. So most are going to do great with this regimen with just Glecaprevir, Pibrentasvir for 8 weeks. But again, if you do have a failure, because both these drugs have a very, very high barrier to resistance in that combination, if it does happen to be a rare failure, they may have multiple resistance mutations and very high level resistance to any HCV inhibitor in those two classes, so protease inhibitors or NS5A inhibitors. So again, this was the first to really give some idea of how to approach a retreatment for those patients. The lone virologic failure was a genotype 1 patient that did happen to have NS5A resistance going into the study, so they had a dual resistant variant that would have predicted resistance to Pibrentasvir, the NS5A component in the regimen. But there were many more patients, including patients that had both protease inhibitor and NS5A inhibitor resistance, that were cured in this study. All 5 that had dual resistance going in were cured. So, whether resistance testing is going to play any role in management of these, still an open question from this study. The numbers are too small, but it doesn't look like resistance is necessarily a big component of that. The fibrosis stage, so cirrhosis, is probably the biggest factor in retreatment of these patients. That was seen in this study. The one failure was a cirrhotic. You can't say anything with any certainty. But in other studies too, it seemed like cirrhosis, perhaps more so than viral resistance, is the determiner of how they do on retreatment.